Most people with jaw pain do the same thing. They rub their cheeks for a minute, feel nothing change, and assume massage just doesn't work for them. But the clinical reality is that your jaw doesn't operate in isolation. There's a chain of muscles running from the base of your skull all the way down through your neck, and tension anywhere in that chain feeds directly into jaw pain. We've got 9 specific techniques that work through that whole system layer by layer, and we're starting right now. Number 1, Masseter muscle circular massage. Most people who rub their jaw are working the surface layer of the masseter and stopping there. The masseter actually has 3 overlapping sections running from your cheekbone down to the angle of your jaw, and the top layer is just the entry point. The deeper trigger points stay completely untouched, which is why the relief fades within an hour. This muscle is one of the strongest in the body relative to its size, and it's almost always overworked in people who clench at night. When it's chronically tight, the pain doesn't stay local. It refers up into the ear and across the cheek in patterns that get misread as sinus pressure or ear infections for years. Place 2 or 3 fingers flat against your cheek, just in front of the ear. Work in slow circles from the cheekbone downward, using around a 5 to 7 out of 10 pressure. Firm enough to feel the tissue without bracing against it, giving each spot 30 to 60 seconds. Number 2, temple to jaw release technique. The temporalis covers most of the side of your skull, and almost nobody treats it because it doesn't feel like a jaw muscle. But it attaches all the way up into your temple, and when it's tight, it pulls the jaw upward and backward with every single bite. What makes this muscle tricky is that it has 3 distinct fiber regions, and they each send pain to different places. The anterior fibers refer pain to the upper teeth and forehead, the middle fibers send it to the side of the head, and the posterior fibers, closest to the ear, produce a deep ache that most people describe as behind the eye. Treat one region and miss the others, and you've only done part of the job. Start just above the eyebrow and use 2 finger pads to work slow circles in a line from front to back, following the curve of the skull toward the ear. The posterior fibers need extra time because they're denser and sit closer to the bone. Number 3, gentle jaw joint compression and release. The TMJ sits in a small depression just in front of your ear canal, and it's one of the only joints in the body that functions as both a hinge and a sliding joint. That complexity is exactly why it breaks down under sustained stress. When the surrounding muscles stay tight, they compress the joint space and restrict the articular disc, the small cushion between the bones, which is where clicking and catching sensations actually come from. Most people avoid touching the joint directly because it's sensitive and they don't know what they're doing there. But that avoidance cuts off the proprioceptive input the joint needs to regulate muscle tone around it. Place one fingertip over the joint, apply light pressure at about a 3 out of 10, hold 5 seconds, then slowly release while letting the jaw open slightly. That combination of compression and gentle movement is what activates the mechanoreceptors and tells the surrounding muscles they can stop guarding. Number 4, finger glide along the jawline. Along the bottom edge of your jawbone, there are muscle attachments that most TMJ protocols never touch. The digastric and mylohyoid muscles anchor along this ridge and control jaw opening and swallowing. And when they're tight, they create a pulling sensation under the chin that makes the jaw feel held shut from below. These muscles are almost never sore when you press directly on them, so people don't connect them to their jaw pain. Instead, the tightness shows up as fatigue, difficulty opening wide, or a vague fullness under the chin. And because those symptoms don't point to an obvious location, these muscles stay tight for years. Use your index finger pad, start at the chin midline, press upward into the bone, and glide slowly toward the ear. You're staying on the bone the whole time, not pressing into the neck. What you're applying is shear force right at the attachment site, where adhesions actually form, and that's what starts to change the tissue. Number 5, inside the cheek masseter release, gentle pressure only. Everything we've done so far has worked the outside surface of the masseter. but the deep fibers of that muscle sit against the interface of the ramus, the vertical part of your jaw, and external pressure never actually reaches them. You're pressing through skin, fat, and the superficial layer before you even get close. Those deep fibers hold some of the most stubborn trigger points in the whole jaw system. Wash your hands thoroughly, and consider a nitrile glove if you have a latex allergy. Place your thumb inside your cheek and your index finger on the outside, sandwiching the masseter between them. Start near the cheekbone and work downward with slow, small circles, using the grip to stabilize while your thumb applies gentle inward pressure from inside. Stop immediately if anything sharp or shooting happens. Clinical evidence on conservative manual therapy confirms that reaching the full depth of the masseter produces better outcomes for both pain and mouth opening than surface work alone. Number 6. Knuckle sweep under the cheekbone. Just below the cheekbone, where the masseter originates at the top, there's a channel of tissue that concentrates tension from both the masseter above and the deeper pterygoid muscles below. When it's tight, the jaw doesn't track straight down during opening. It drifts to one side, and that asymmetric pull accelerates joint wear over time. Make a loose fist and use the flat surface of your middle knuckle to sweep slowly along the underside of the cheekbone, starting near the temple and moving forward toward the nose. A knuckle works better here than a fingertip because it spreads pressure across a wider area of tissue, so the muscles don't guard against it the way they do with sharp, focused fingertip contact. You'll find spots that feel denser or more tender than the surrounding tissue. Pause on those for about 30 seconds. After 2 or 3 full sweeps, check your jaw opening in a mirror, because if it was drifting before, it'll often track more centrally now. Number 7. Ear to jaw TMJ pressure point massage. Right in front of your ear canal, there's a small depression where the joint sits, and running downward from that point toward the jaw angle is a line of tissue that's packed with nerve endings. Mechanoreceptors, pain receptors, and autonomic fibers all concentrated in one narrow strip. When the surrounding muscles stay chronically tight, that tissue sits in a low-level state of alarm, and it's what produces the background ache most TMJ sufferers carry all day without quite knowing where it comes from. This technique uses still, sustained pressure rather than circular motion. Find the joint depression, then identify 3 points moving downward toward the jaw angle, roughly a centimeter apart. Press firmly and hold each one for 45 to 60 seconds without moving. Don't press deep enough to feel your pulse, because the carotid sits further back and deeper. But holding that pressure long enough activates the gate control mechanism in the brainstem, which processes jaw pain signals and can dial them down with consistent, non-threatening input. Number 8. Chin lift and jaw relaxation hold. Most people assume that if they're not actively clenching, their jaw is relaxed. It's not. The masseter and temporalis maintain a baseline level of contraction in people with chronic tension, keeping the teeth hovering just millimeters apart instead of fully separating. Over weeks, that low-level holding is the equivalent of making a mild fist all day and never fully opening your hand. Place your index and middle fingertips under your chin and apply very gentle upward pressure, just enough to feel the jaw's weight. Let the mouth drop open about a centimeter against that support, and hold for 30 seconds while breathing slowly through your nose. What happens neurologically is that the finger support tells the jaw-closing muscles they don't need to keep holding, and the slow breathing activates the parasympathetic nervous system at the same time, so the resting tone of the masseter and temporalis actually drops during the hold. Number 9. Neck to jaw tension drain massage. The suboccipitals sit right at the base of your skull, and they're the upstream source of a lot of jaw pain that never gets traced back to them. When they tighten, they shift the angle of your jaw relative to your skull and load the TMJ unevenly. Place both thumbs side by side just below the base of your skull. Press firmly upward into that ridge and hold for 30 seconds. Then use a gentle pinch grip along the sternocleidomastoid, working from behind the ear down to the collarbone. Finish with broad circles across the upper trapezius on both sides, and don't squeeze both sides of the neck at the same time. What you've just worked through isn't 9 random massage techniques. It's one connected tension system running from the jaw into the temples, down through the neck, and back into the base of the skull. That's why spot treating the cheek alone almost never lasts. When you release the surrounding muscles and fascia in the right order, the jaw finally stops compensating for tension coming from everywhere else. If this gave you some relief or helped you understand your symptoms differently, there are more videos on the channel covering neck pain, headaches, stress tension, posture-related trigger points, and the hidden muscle chains most people never realize are connected. Thanks for spending these minutes with me, and I'll see you in the next one.